Now talking about the amputations of the foot. Different amputations of the foot. The first type of amputation of the foot is Chopard. The Chopard. What is Chopard amputation? Chopard amputation is done at the intertarsal joint between the talonavicular and the calcaneocuboid. Now, suppose this is our foot. Just suppose this is our calcaneum. This is our talus. This is our navicular. Calcaneum, talus, navicular, and this is our cuboid. This is medial, intermediate, and lateral tarsals, and these are metatarsals. Now we have to be here focused here. This is talus and navicular. This is calcaneum and cuboid. This is the joint between the talonavicular, and this is the joint between calcaneo and cuboid. Then if amputation is done at this area, this is known as Chopard amputation. If amputation is done at talus and metatarsal, between the talus and metatarsal, tarsal and metatarsal, tarsal and metatarsal, this is known as these are regular. I have just made this some smaller, some bigger. These are normal like this. This is known as Lisfranc amputation. Chopard at intertarsal joint between talonavicular and calcaneocuboid, between tarsal and metatarsal bones. Then we have something known as Sims amputation. Sims amputation is done at 0.6 centimeter above 0.6 centimeter above the dome of the talus. 0.6 centimeter above the dome of the talus. This is known as Sims amputation. But then there is something called sedimentous amputation. Why this sedimentous amputation was done? Because in Sims, since it is 0.6 centimeter, both the malleoli will be spared. There will be malleoli. Since malleoli will be spared, then we will have wide ways. Doctors don't want wide ways because it will be difficult for the prosthetic to fit. So Sarmentus amputation was developed. Sarmentus amputation is just like Sims amputation, only it is 1.3 centimeter proximal to ankle and includes both the malleoli. But since it will be 1.3 centimeter, suppose it is here 1.3 centimeter, we have removed, the doctors have removed a big chunk of the bone. So the doctors wants to salvage most of the limb part or the body part. So they try to only amputate minimum part. So another amputation technique was developed, which is known as Boyd amputation. In Boyd amputation, after the talectomy was done, this calcaneum was then fused to the tibia. This calcaneum was fused to the tibia. Everything was removed and this calcaneum was fused to the tibia, but it again had white waste, so this was also refused. And another Pirogov amputation was done. In Pirogov amputation, what was done is that in void up to this was removed and this calcaneum bone was then added here. In Pirogov, up to this was removed, then distal part of the calcaneum was also removed. Then calcaneum was up to this, initially up to this it was amputated, then calcaneum was cut and rotated to fuse with the tibia. Then this part was cut and up to here we had amputation. Then this part and this part was joined, so it looked something like this. So we removed minimum part of the bone and we had small base also, narrow base also. So this is known as Pirogov amputation.